Good evening and Happy New Year, everyone. Welcome to the Haverhill Journal Live for Monday, January 11th, 2021. I'm Lindsay Paris, here with you tonight from the HC Media Studio. Tonight, we're discussing the COVID-19 vaccine, when you may be able to receive it, and how that's going to happen, with Mayor Fiorentini and with the Greater Lawrence Family Health Center's Rich Napolitano, who will fill us in on their vaccine rollout here in the Merrimack Valley. Then, there's a new mural in downtown Haverhill, but this mural is a little different. It was created by outstanding young readers from Haverhill schools. We'll tell you more about it in a little bit. But first, Mayor Jim Fiorentini is joining us for his latest update. Mayor Fiorentini, thanks for being here.
Thanks for having me, Lindsay. We have good things happening in Haverhill. When you watch the national news, it's very depressing, and you certainly never know there was anything good happening anywhere in the country. And we're all shocked and stunned by what happened on January 6th at our nation's capital. I just don't understand how a terrible thing like this could happen. In the younger days, I've been down to D.C. I've seen peaceful protests take place during the Civil Rights era. The buildings were all carefully guarded. They had troops out. And how this could happen to our nation's capital is stunning to me, that people would go in and try and disrupt the most important thing, if you think about it, that the Congress does every 4 years, which is to certify who's going to be the next president of the United States. It's absolutely stunning. But on a local level, we are rolling out the new vaccine program. Today, as we speak, I'm talking to you on Monday, we're vaccinating a fire department. We're estimating that about 80% of our fire department has agreed to be vaccinated, and they're over at the Citizen Center getting the vaccine now. The police department is on for later on this week. Now, it's very important that we vaccinate them first. The first of the first with the frontline healthcare workers, because their lives are at stake every day dealing with people who are ill. They may get the vaccine. We've lost 2 nurses in Haverhill to this COVID epidemic, and we certainly want to vaccinate them first. After that, we want to vaccinate the people that can help us with the vaccination program, and that's nurses, EMTs, LPNs, nursing students, medical students, all the people that are authorized to administer the vaccine. Many, many firefighters and some police officers are EMTs and paramedics and will be available to help us. So we're doing them today. Let me go through with the public, because I get a lot of calls on this, when it is the public's turn, because that's what we're all interested in, me as well as you. And the state sets the priorities, not us. And let me go through and see if I can present that now on the screen. If you go onto the state website and just type in mass.gov, and then at the top, type in coronavirus vaccine or vaccine, you're going to see this chart, and you're going to see the phases that the state has. We're in phase 1 right now, and we're going to do congregate care settings next, home-based healthcare workers, and then healthcare workers that aren't immediate frontline workers. But starting in February, as close to February 1st as we can, then we start with some members of the public. Individuals with 2 or comorbidities. A morbidity is something that makes you more susceptible to getting the virus. It hasn't been determined yet how it's going to be determined. People have 2 or comorbidities. And everyone 75 years of age or up is eligible. Now, this chart that you see on your screen, the bullet points are in order. So people 75 and up are eligible to start getting vaccinated in February, as soon as we are authorized to do that, sometime in early February. We're working on a plan now that will allow people to sign up. There is no place to sign up right now, but the state will come up with a sign-up list. So I want everyone to be just a little bit patient on this. And the state is setting up mass vaccination sites throughout the Commonwealth, and we're going to set up some sites in Haverhill, the mass vaccination sites where thousands of people will be able to drive in, will be at the Topsfield Fairground and also at the Lawrence General Hospital. But we intend to work with Greater Lawrence Family Health. I know they're coming on the show next, and also with other providers, Pentucket Medical and the hospital, to have some sites here in Haverhill. And we're dusting off. We actually have pandemic plans in the city. They were last updated a few years ago, and we'll be dusting those off, reviewing them with my public health task force to see if we can set up some other sites in the city of Haverhill by February 1st. After the people who are 75 and up, then we start with the essential workers. They are teachers, K through 12 teachers, grocery store workers, transit workers, people that work in our food production agency. You're eligible. I know there's a lot of you out there. There's probably 2,000 people who work in the food production industry. You're eligible starting in February. Public Works Department workers, and all of you eligible starting in February. And then after that, still into February, we're probably into mid-March now, adults 65 and older, and people with one comorbidity. And then if we can switch over on the chart to the third column, somewhere between April and June, we start with the general public. So those of you who are out there that don't fit into one of the categories on phase 1 and phase 2, you're under 65, you don't have a comorbidity, and you don't work in one of these industries, sometime between April and June. It is our goal to have this done as quickly as possible. It's an incredible logistical hurdle. We need people to administer the vaccine, doctors to manage the program. We need sites. We need the vaccine, none of which we have right now. So I'm going to put out a plea to the public. If you are a retired nurse, a retired doctor, a retired LPN, if you're a medical student or a nursing student, and you would like to help in the vaccine distribution when we get to the public phase, I want you to go on to the city website, and starting tomorrow, we're going to have a link for you to log in and volunteer to assist us. We're revitalizing our Medical Reserve Corps, which we've had for years. We have about 15 people on it. We need you, if you're listening, to assist us so that we'll be able to vaccinate as many people as quickly as possible. We know that with 65,000 people to vaccinate and probably 50,000 who are above, who are over 18 and who are willing to get vaccinated, vaccinating 50,000 people is an enormous task. We don't want it to stretch out for a year. We want this done as quickly as possible. We need your help. So please log on, sign up, and let us know if you can help us. Thanks, Lindsay.
Thanks, Mr. Mayor, for being here tonight. That's really fascinating information, and in mobilizing the retired nurses, doctors, medical professionals, and medical students should be a great help. And thank you so much for those of you who do. Stay up to date with the mayor.
Thanks, Lindsay.
His blog. Thank you. Good night. By subscribing to his blog at jimfiorentini.wordpress.com, or by reading his updates on the Haverhill News page on Facebook, and visit the city's website starting tomorrow if you are a retired medical professional or student to sign up. It may be the most universal question on people's minds right now: when can I, my family members, and friends receive the COVID-19 vaccine, and how will it happen? We just heard some of that from the mayor, but we also have Rich Napolitano of the Greater Lawrence Family Health Center, who's here with us tonight to talk about COVID vaccinations, the GLFHC's mission, and more. Thanks for coming on the show, Rich.
Thanks so much for having me. Appreciate being here.
So tell us a little bit about the Greater Lawrence Family Health Center. What is your mission?
Greater Lawrence Family Health Center is there to serve the underserved in terms of healthcare, regardless of the patient or the community member's ability to pay. We've been around since 1980. We operate 5 clinical locations in the city of Lawrence, 1 in Methuen, and now 1 in Haverhill. We just opened 1 in Haverhill back in November, and we're slowly rolling that out, but we're thrilled to be here in the city. We're at 755 Main Street in Haverhill, right off 495.
Right, so convenient. You just opened up that clinic in November. Now, what services are available there to Haverhill residents and other people in the Merrimack Valley?
You know, at all of our clinics, our primary focus is primary care, full spectrum family medicine. At that particular location, not only do we provide that, we also provide behavioral health services, pharmacy, and lab as well. So when someone comes in, if they need lab work, they can get it done right there. They can get their prescriptions filled right there. And that's what we do at all of our clinical sites.
Right, so you offer the basically full spectrum of services. We were talking before, and you had mentioned, you have a focus on helping also the low income, the homeless. Do you require insurance at your locations, or if someone doesn't have the ability to pay, how do they deal with that?
Sure, we take all insurances. Primarily, a lot of our patients are on Medicaid or Mass Health, but we do take all insurances. We also we're able to tap into the health safety net, so we can provide services to the uninsured as well. We don't turn people away. That's first and foremost.
Excellent. No, that's such a great thing to have here in the Merrimack Valley, such a need for it. Now, I'm sure during the COVID-19 pandemic, you have faced a lot of different challenges. So tell us a little bit about what that's been like.
Yeah, the challenges, they hit us right away, like they did most healthcare providers. We were able to operationalize telehealth, which I'm sure is a kind of a catchword, buzzword now in the industry. We were able to operationalize that pretty quickly within a week. So since the beginning and the height of COVID, we've seen probably upwards of 60 to 70% of our patients via telehealth.
Oh, wow.
Which was really important that
Okay.
we have that and we're able to stand that up
Right.
for our patients.
Right.
We have over 60,000 patients, close to 62,000 patients, and this was important for us to be able to do that. A couple of the areas and challenges that we've faced, PPE, personal protective equipment is obviously at a premium.
Right,
And for
right.
us, we've tried to stay ahead of it and continue with a stockpile of that so we can protect our clinicians and our patients.
I know, I especially remember at the beginning of the pandemic, what a challenge that was, trying to get the masks and the face shields and the sanitizer,
Yeah, it sure was. And, we didn't know what we were facing at the time. We got some wonderful donations from really some area partners and community partners throughout the Merrimack Valley, which really helped us in the beginning until we really got our feet on the ground and realized what we were up against. But it certainly helped, know. But we're trying to stay ahead of it now.
So moving on to the vaccine, of course, everyone is wondering, when will I be able to receive it? My family, my friends, my elderly relatives. So will the GLFHC, let me say that correctly, will you be administering the vaccine at your locations?
Yes, we will be. We'll be following the state and the CDC's rollout. Okay, so right now we're in phase 1, like everyone else is. We have vaccinated our staff, at least the ones that wanted to get vaccinated. We had plenty of vaccine in this first rollout. We had the Moderna vaccine. I was able to get vaccinated a couple weeks ago, and a lot of our staff was. We're going to be following, like I said, the phase 1, phase 2, phase 3 rollout. We're looking at community patients and the like, probably closer to the end of January, early part of February, but it's really dictated by the state and the CDC. So we're really dependent upon Department of Public Health and when they tell us they're ready to roll it out to those groups. But we'll certainly be active in the communities that we serve, not only at our clinics, but we'll also be active in the different communities that we serve. We'll be active in Lawrence for sure. We'll be active in Haverhill for sure. We'll be partnering probably, I would bet, with Holy Family Haverhill and the city to make sure that we roll out the vaccine to our patients and to the community. We have about 4,000. Before coming to Haverhill, we already had between 4,000 and 5,000 patients already coming to GLFHC from the city of Haverhill.
Oh, my.
And we know that that's going to increase. We're accepting new patients now, so as the COVID vaccine rolls out, we're going to see even more people.
Right. Now, logistically, I know a lot of people are wondering too, how does that happen? Will that be something we need to pre-register for? Do you guys know anything about the logistical aspect of that yet?
Yeah, depending on what the state requires us to do, we're in the process of putting that rollout plan together right now in order to operationalize it. I can tell you that we did do a pre-registration process. Once we finished with our staff, we started to reach out to area healthcare partners, because they're part of phase 1 also. So we've been vaccinating some area healthcare partners, but we had a pre-registration process for that as well.
Right.
And I imagine we'll do the same with patients and members of the community.
Right. So you said you received the vaccine. Just tell us, what was it like? Was it easy, simple?
It was easy. I mean, everybody reacts differently to vaccines and vaccinations, right? So for me, I didn't have any other side effects other than a sore arm, but most of us get that with the flu vaccine and other vaccines. There have been some other folks that have had side effects like a fever for a short period of time, or aches and pains, or nausea or something like that. But it depends on the person.
Right. Do you have any idea where locations? Will these be administered like in a large outdoor location? The mayor had mentioned that perhaps in like large parking lots, places like that, instead of, administering them indoors because there will be so many people coming.
Yeah,
to
I
receive
think it
vaccines.
could be a mixed bag. I think we're looking at that right now. We have to have more conversations with the mayor and with the city here in Haverhill, but I know that in Lawrence, we've looked at outdoor locations as well as indoor locations as well.
Right.
So I think there'll be a little bit of both.
Okay. Lastly, how can we stay updated? How can the public find out? Is there a place to follow you on your website, or a way to keep up with the COVID vaccination schedule?
As information comes out, we always keep our website up to date, glfhc.org. We're pretty heavily involved in social media. So we can easily be found on social media or Instagram or Twitter. We try to move this information out as quickly as we get it, and we're pretty active. Those are probably the best ways. We also communicate quite regularly with our own patients via email and text messaging as well.
Excellent. Okay. And if they're interested in becoming a patient of your primary care, same website. What is your website?
Yep, www.glfhc.org.
Perfect.
And they can just come on that and they'll find information and we'll help them out.
That's perfect. Rich, thank you so much for coming on the show tonight. And a special thanks too to the Greater Lawrence Family Health Center for all that you've done for everyone here in the Merrimack Valley.
Thanks so much. And we're thrilled to have Haverhill Family Health Center now part of the city.
To keep kids engaged in reading and learning at home during last spring's school shutdown, Haverhill Promise initiated the Reading Takes Us Places program, which rewarded students in grades K through 12 for keeping up their literacy. Out of that grew the idea to create a reading mural. Outstanding readers worked with Haverhill Promise and Creative Haverhill to create this colorful mural under the railroad bridge on Washington Street. No matter who we are, reading takes us places. And a new mural under the railroad bridge on Washington Street, created by Haverhill Promise, colorfully celebrates that concept.
It's so great to have you all here to celebrate our citywide Reading Challenge mural project, Reading Takes Us Places. This project came together out of the citywide Reading Challenge, which was a way for our students to be motivated to practice their daily reading during the pandemic, especially at the start of it when the schools were shut down for a couple weeks. It was really great because it led right into the summer and the library's summer reading challenge. And so this was really just the city coming together to find ways to keep our kids reading. And this mural represents that perseverance and dedication to practicing daily reading and hopefully helping our kids to not fall too far behind in their learning over the course of this year.
In August, over 50 students from around the city painted the mural's panels. Students were chosen based on their participation in the Haverhill Promise Citywide Reading Challenge, which encouraged daily reading during the school shutdown in the spring.
We were so thrilled when Jenny with Haverhill Promise reached out to collaborate on this mural. We got to work with her and with Haverhill Promise to take what the kids did with their reading and turn it into this beautiful mural. We brought in some local artists to help do that and worked in front of our Cogswell building, which will be the Cogswell Art Space, to be able to do socially distanced painting with the kids. And it was just a joy to work on, and they did such a wonderful job.
I read for a week or two, and I did it every single day, and it was pretty fun. There were like 2 kids there when I was there, and we all got to paint a mural. The picture is a boy on a canoe.
We had so much fun with this project. It really was kind of just a light and just a joy to be able to do something. The kids were so much more excited about it than I even thought that they would be. We couldn't get some of them to leave. We said, oh wait, you gotta save some for the next group that's coming through, because they were just so excited. They just wanted to keep painting and keep filling in. And I think that was really fun for us to see. Absolutely. And it was just so cool to take a reading project and turn it into an art project. And the kids, they just did such a phenomenal job. I mean, these started as just white blank panels, and they made it into these beautiful, vibrant art pieces that will be here forever. And we're just so proud of them. They did such a great job. It was so much fun.
Kids had to not stop reading to get smarter.
See the mural on the eastbound side of Washington Street, brightening up that passageway right underneath the railroad bridge. And that's our show for Monday, January 11th. Thanks so much for joining us. Watch the Haverhill Journal live again at 5:30 and 9:30 p.m. every weekday night on Channel 22. And as always, keep watching HC Media for up-to-date information, series programs, public service announcements, and more. I'm Lindsay Paris. Good night.